In this video, you'll learn how to prepare for your brain or spine surgery with Neuroscience Group. It's intended to provide general guidelines, and our team will be in touch regarding your specific case information. Medications. Stop all herbal supplements, multivitamins, and vitamin E, as well as over-the-counter NSAIDs like ALIF, Advil, ibuprofen, Motrin, and Excedrin at least 7 days before surgery. Our team will contact you in regard to your specific medications and when to stop them. Eating and drinking. No solid food after midnight the night before your surgery. It's okay for you to have clear liquids 2 hours until your arrival time at the hospital. You can drink things like water, apple juice, tea, clear soda, black coffee, Gatorade, or Jell-O. Any color but red. Don't use cream, sugar, or lemon in your coffee or tea. If you are a diabetic, please remember to check your blood sugars frequently leading up to surgery to prevent hyper and hypoglycemia. Our team will inform you of your specific time to stop drinking before arriving at the hospital. Important tips. Smoking increases your risk of post-operative complications, poor wound healing, infection, and compromised bone fusion. You will be required to quit smoking, vaping, or chewing tobacco at least 4 weeks prior to a fusion surgery. Your surgeon may decide to postpone or cancel surgery if you have not quit all nicotine products as directed. If you are having a cervical or neck surgery, do not shave your neck within 48 hours of your procedure date. Because narcotic pain medications cause constipation, you'll want to purchase over-the-counter Miralax powder or Senecot to have on hand at home after your surgery. Preparing your home for recovery. Remove all area rugs and extension cords out of walkways. They're tripping hazards. Arrange frequently used items at waist level to avoid bending and reaching. Purchase or borrow any medical equipment to assist with activities of daily living, like a bathtub grab bar, toilet riser, shower bench, shoehorn, or extended length grabber. Preparing your skin for surgery. Sleep on freshly laundered bed linens the night before surgery, and don't allow your pets to sleep with you. Use HIPAA-Cleanse or an antibacterial soap as outlined on page 14 of your spine surgery guide. More important tips. If you develop any flu-like symptoms, a temperature of greater than 101 degrees, a cough, wheezing, or respiratory symptoms or rash, contact our office to reschedule. You'll receive more specific details about your arrival time for surgery within 2 days of your surgery date. You will have your first post-op appointment typically around 10 to 21 days following your surgery. Our team will notify you of your specific date and time. Our goal is to educate and empower you so that you can recover your health and get back to the everyday moments you love.